You're all present here for the World Breastfeeding Week. You all can see on the banner also, it is WABA. WABA means World Alliance for Breastfeeding Action. So it is a thing that is giving all the formulations, what has to be done in this 1 week, what are the updates about this breastfeeding, and also what are the importance of this day. So without any delay, I would like to invite the Dean of Narayana Medical College and Hospital, Dr. P. Srinivas Reddy garu, to please come on to the dais. Next, I would like to call upon Dr. R. Vishwakumar garu, the Vice Principal, to please come on to the dais. Next, I would like to call upon Dr. Vanaja ma'am to please come on to the dais. Next, I would like to call upon the Nursing Superintendent Manimaigalai ma'am to please come on to the dais. Next, I would like to call upon Dr. Jyoti Kanjivaram ma'am, the HOD of Department of Family Medicine, to please come on to the dais. Next, I would like to call upon Dr. Chandrasekhar Naidu, sir, the HOD of Department of Pediatrics, to please come on to the dais. For everyone present here, the first emotion we all feel is the mother. So today is World Breastfeeding Week from August 1st to August 7th. So this 1 week, what are we going to do, how it is going to be, and what are the things we are all going to be is something which will be told in this program also. Before we move forward, I request all the dignitaries present on the dais to please participate in the lamp lighting ceremony. I would request the Dean of Narayana Medical College and Hospital, Dr. P. Srinivas Reddy garu, to address the gathering about the importance of World Breastfeeding Week.
All the dignitaries and the dais and off the dais, and also the my dear students and nursing staff of Narayana Medical College and interns and my dear students. And thank you very much for participating in this wonderful program. So you all know that the breastfeeding is the greatest nature's gift to the humanity. Actually, this breastfeeding is not the food to the baby, and this breastfeeding is the vaccine, and this is the medicine, and also everything to the baby. So never think that the breast milk is only food for the baby. In the hands of the mother, the baby always feel the very emotional and also very secured. And so never think that they are feeding should not feel that they are feeding the baby, but they are giving the unconditional love to the baby. So this one should not forget. So don't think that this breastfeeding is, of course we can feed through the bottle also the same milk, but if the mother gives the milk by keeping the baby in her lap, this always gives highly secured environment to the baby, and also it gives the emotional bonding between the baby and the mother. So this is what always we have to remember. And this breastfeeding, of course, reduces the many infections in the baby. And not only that, it can give the immunity to the baby, and it gives all kinds of required elements to the baby which may not be provided through the bottle feeding. Breastfeeding may alter the body nature, or it may cause for so many things in the mother, right? With this, thank you very much for all the departments participating in this.
Now I would like to request the Vice Principal of Narayana Medical College, Dr. R. Vishwakumar garu, to share his views about the breastfeeding.
As you know, the theme and the concept of the breastfeeding, which has been briefed by each of who have attended here. And as our Dean sir has rightly put it, it is really unfortunate when there is a need we feel to really educate the mother to feed her baby by breastfeeding. Actually, these are all natural instincts. Even when the calf is delivered by the cow, nobody teaches it. Straight away, naturally it goes to the udder and then it starts feeding itself. Now we calling ourselves cultured, civilized and educated. Now even to educate ourselves we need things which should happen very naturally. Even listening to the cry of the baby is enough for the mother to eject the milk. Oxytocin hormone, the bonding hormone is released, and the benefits of breastfeeding, it is all well-known facts. keep the mothers informed and then make them sensitized towards this healthy practice. Let us do our bit to spread the message. Thank you for the opportunity.
Now I would like to call upon the HOD of Department of Gynecology, Dr. Prasanna ma'am, to address the gathering. And I would also like to ask one small thing, is really wet nursing happening in our hospital?
I want to tell one or two things. The one thing is what we are actually not doing is first golden hour feeding. So in many of the places they used to put the baby on breast when the mother is on the OT table or the delivery table, but we are not doing it. And that is not only important for the mother to reduce the blood loss and to reduce and cause more contraction of the uterus, and also better involution of the uterus, it helps. And one more thing is, the community people have an idea, when the buffalo or cow delivers, they allow the baby immediately, cow for the baby, immediately on the milk, which is good for that baby. But why not we are doing that for humans? And none of the people are giving milk in first 3 days, 3-4 days, until the breast is engorged and getting white color. Milk means they think always white color, which is first 3 days milk is very, very important for the sake of the baby in getting better immunity and resistance in their future life, and should be continued for at least 1 year and to be continued for 2 years. So as a medical profession, it is our duty for everyone to promote all the pregnant women from the antenatal period itself to motivating towards the giving breast milk.
Now I request Mrs. Manimegalai ma'am, the nursing superintendent, to please address the gathering.
Andarkum namaskaram. Sincere greetings to Dean sir and other dignitaries on dais and all the staff and the interns and everyone. The nurses play a vital role in encouraging breastfeeding. By promoting and ensuring the breast milk, we build a healthier planet. We have to initiate the breast milk with 60 minutes of birth and to be continued for 6 months without any supplement. By promoting breastfeeding, we are bandaging the health of an entire generation. Whatever I have prepared already, Dean sir and we Vice Principal sir and Prasanna madam, everybody told. So I don't want to repeat those things. So let us, as a nurses, we have to encourage all the mothers to continue their breastfeed. So as a nurses, we have to encourage breastfeeding. Rather than teaching latching, we have to relieve the fear of the mothers about the breastfeeding. All the best.
Jyoti Kanjivar ma'am, the HOD of Department of SPM, to please address it.
So most of the speakers now just told you everything about breastfeeding and all these things. Few points I want to stress is this: giving awareness or making the mother aware of giving breastfeeding should be done right from the antenatal period. Every time the mother comes for an antenatal checkup, it is must that she has to be counseled about breastfeeding. Most of the mothers, what they complain is, I am not having milk, there is no milk production and all these things. But as the baby suckles, the milk will slowly come with the action of the prolactin and oxytocin. So you have to encourage the mother that you make the baby suckle so that milk will produce by itself. Thank you very much.
Dr. Chandrasekhar Naidu sir, to please address the gathering.
There are two things which are irreplaceable, that is mother and mother milk. These two are irreplaceable. How to get better breast milk? Minimum of 3 liters of water per day, fiber rich and water rich diet. These are the two requirements to get a good breast milk.
I request Dr. Vaishnav to address.
For every woman to become a mother is considered as a greatest gift by the God, and likewise for every child, breastfeeding is the greatest gift that every mother can give. So not only about the nutrition, it also helps in having a great bond in between the mother and child.
Thank you everyone who are all present here for your valuable time, and this has been a wonderful collaboration of all the units. It's been 1 year we have started very actively. This collaboration I think is coming out very good, and the name itself is World Alliance for Breastfeeding Week. The name itself is suggesting that we need to collaborate actively for the active output of whatever health education we are going to give. So this event, I request all the students to come much more forward and show all your ideas. All your ideas will be definitely recognized in this college. That is what we are all doing from so many days. We have the active support of the institution. So I request all the students to come outside still more and show all your talents.